So my name is Amanda, and I'm with the Tampa Hillsborough County Public Library. And I'm here with tonight. I'm so happy to welcome back Rebecca McDonald. She is with Shine. She will tell you a little bit about that shortly. We're going to go ahead and talk about Medicare Part C, Part D, and SMP tonight. But before we get right into that, I am going to go ahead and recommend a book to everyone. This is a book about, of course, as I mentioned, we are sharing those former programs on our YouTube channel, so you can get a lot of great information there. But if you do want a resource that you can read, you need to see, you would like to see written out, which I know is definitely how I learned. We do have a book in our ebook selection, which is in Overdrive. You can find it at hcplc.org/ebooks. And this is called Maximize Your Medicare. And this is about getting your maximum benefits through Medicare, reading about all the different parts of the program and how it might apply to your situation. This does have the most up-to-date information. It was published in 2020, but it does have the most up-to-date information for the Medicare plans through 2020 and 2021. So if you are interested in that book, you can find it at hcplc.org/ebooks. Having said that, I am going to go ahead and I am going to turn the controls over to Rebecca, and we will jump right into the program this evening.
We're kind of starting in the middle of the program because we did the first half the other night. So just by way of review, there's two paths to Medicare. One side, which we had just almost finished discussing, is original Medicare Part A, which is hospital coverage, and Part B, which is medical coverage. And with original Medicare, you can optionally have a Medigap policy to cover the charges that are not covered by Medicare. So we were just getting to Part D, which is the prescription drug plan. This is the easiest one to remember because D for drugs. But anyways, whether you have original Medicare or you go with the Medicare Part C, the HMOs and the PPOs, you still need to have a prescription drug plan. Medicare really likes you to have a drug plan, so much so that if you have no prescription drug coverage, if you go any longer than 63 days without prescription drug coverage, Medicare will start imposing a fine. There's a penalty that you'll pay. So by the time you finally decide you should get a Part D plan and get some coverage for your prescriptions, your monthly premium will be more than your neighbors because they're going to add that penalty, and that's forever. So a lot of people just say, I don't take any drugs, I don't really want to spend that money, but then just to make everyone happy, they'll get the least expensive prescription drug plan. Medicare's happy, you've got a drug plan, and you never know when you're going to need it. So Part D, as we said, covers prescription drugs. You do have to get this from an insurance company. It does not have anything to do with Social Security or CMS, the Center for Medicare and Medicaid Services. All of the Part D prescription drug plans are vetted by Medicare. They can't be sold as a Part D prescription plan unless they have been approved by Medicare. So if you're retired and part of your retiree benefits includes secondary insurance, in other words, if you've been able to take your employer insurance and use that as your second insurance, and it includes prescription drug coverage, you do not have to buy a Part D plan, as long as it's what they call creditable coverage, which chances are it is if you've got part of your retiree benefits. So Medicare doesn't care if you're getting it from your employer as a retire benefit or you're getting it through Part D. They just want to make sure that you have a prescription drug plan. So if you retire and you take your employer insurance as your supplemental insurance and it includes prescription coverage, you do not have to purchase a Part D plan. And SHINE, I forgot to explain it in the beginning. SHINE stands for Serving Health Insurance Needs of Elders. We are a program through the Department of Elder Affairs. We're all volunteers in our group, and we've been specially trained in Medicare. And what we do is we provide you with information, free and unbiased information, to make your informed insurance decisions. So we don't tell you, get this plan, get that plan. We just give you the tools. So when the time comes, you'll be able to make an informed decision. And for those of you that 64 going to 65, you're going to find that your mailbox fills up really quick. And so that's what we do. We'll give some how to reach Shine, the Shine organization. There's some handouts that the Shine Rack card will give you more information about how to contact a Shine counselor. We serve 5 different counties, so we're only a phone call away to answer your questions. So if you end up with a question tomorrow morning and can't remember what I said or how I explained something, you're going to call that 1-800-96-ELDER number. It's 1-800-963-5337 and say, I don't know what she said, but I'd like to understand it more. And they're going to hook you up with a counselor from your county, and they'll talk to you sort of like I'm talking to you now. So this information is available in several different ways to get to it. So that's why we want to make sure people know about the decision they're making for their health care. It's kind of confusing. So getting back to Part D, the drug prescription coverage, each plan has a premium. They vary from high premiums to low premiums. Some plans may have a deductible. So you may find that a plan with a low monthly premium still has this $445 deductible. You see, there's no more than $445 deductible for 2021. The next one, you may see a plan that has a kind of a higher monthly premium, but it does not include the 445 deductible. So there's just different things that you want to consider in choosing a drug plan. The main thing being is it covers all of your drugs. So there's a tool on the Medicare.gov website that's called Plan Finder, Find My Drug and Health Plans. And you can go there and put in a list of your medications, and it's going to pull up a list of drug plans that cover all of your medications. And then it gives you an idea of what the monthly premium is and what the copay is for your drugs. So that the monthly premium can vary. Some plans have no premium. In our county, I don't believe we have any plans that have no premium. All of them have a minimal premium. But again, you want to be sure what they're charging for a copay. You don't want to pick a plan that has a very low premium and then find out that one of your drugs has like a $200 copay. That you're not saving any money that way. So there's a lot of stuff you have to look at. Some plans have no deductible, and so their premiums might be a little bit higher, but you don't have the deductible. And there's usually a copay. A lot of plans with generic medicines, there is no copay. A lot of plans, if you use their mail order, there is no copay. I have a Medicare Health Advantage plan, and I use mail order, and I don't pay. I do have like a $400 deductible for medications, but most of mine are generic. So you want to make sure that if you can, your medications are generic, and look into see whether the mail order would be more cost effective for you. So this isn't quite so important now as it was 4 or 5 years ago, but this donut refers to the donut hole. I don't know if any of you had heard that before, but what happened was there's 4 phases of drug coverage. So the beginning phase is the deductible, which begins January 1st. And during this time, the plan doesn't pay anything, and us, the beneficiary, we pay up to our deductible. Now, if your plan's deductible was 200, we're going to pay 100% up to 200, whatever your plan's deductible is. Once you've met that deductible, you get over into initial coverage, which most of us stay in for the rest of the year. So during initial coverage, the plan pays 75% of the cost of the drugs, and us, the beneficiaries, pay 25%. So all this time, they're adding up the total cost of the drugs. Now, most drugs, if they're generic, is minimal cost, but there are some medications, there's some new insulin pens, or a lot of the respiratory inhalers, or the brand drugs where there's no generics, are extremely expensive. They can run $3,000 a month. And so some people really have a problem with the cost of drugs. So while you're in initial coverage, they're adding up the total cost of your drugs. And once that gets to $4,130, where most of us with zero generics is gonna, not gonna happen. But those people that have the brand prescription drugs for $2,000 or $3,000, it's not gonna take very long. Then they're into what they call the coverage gap. 4 or 5 years ago, this used to be quite an economic disaster for people because when they got into the coverage gap, they were paying 50% of the cost. So now it's down to 25%. What they did, shrinking the donut hole, is they decreased the amount that the beneficiaries are paying in the coverage gap. So you can see now it's 25% across the board. But before they got it down to this 25%, when it was 50% and 45%, it was a, got when people got into the coverage gap, it was a disaster for them. So they're still adding up the total cost of the drugs. And so you've got your $3,000 drug. So once that total gets to 6,550, again, if you've got this $2,000 or $3,000 drug, it's not going to take very long. You end up in what they call catastrophic coverage, and the cost of your drugs goes down to $3.70 or $10 or 5%. So as I say, most of us are in the second phase, initial coverage for most of the year. Some of us with a few little, maybe a couple of more expensive drugs may get into the coverage gap by September. Most of us don't. But what's good about the Plan Finder in the Medicare.gov website is it tells you what month are you going to get into the donut hole, because it has your list of medicines and it tells you what you're going to be paying, and then they know the cost. And so that's always, it's like, okay, well, this is a pretty good plan, except, in November, I'm going to be in the donut hole. So those are decisions you have to make. And I know it sounds complicated, but it's really not. Again, this is all something that a Shine counselor can certainly help you understand and figure out. So the trick here is to try and keep all your drugs generic. Have that discussion with your doctor, because a lot of times doctors don't realize how expensive the brand drugs are, and the generics, to my way of thinking, are just as good. As Amanda said, if you have any questions, just type them in. I think that's pretty straightforward with Part D. So that's one way, one side of the page on how you can get your Medicare coverage with original Medicare Part D prescription drug coverage and possibly a Medigap plan. Or on the other side of the page, we have Medicare Advantage, now called Part C, which includes both Part A hospital, Part B medical, and most of them include Part D drug prescriptions. So you see, it's kind of like one-stop shopping. Over on the left side, you've got your Part B premium of $148.50. You have your Medigap premium in the neighborhood of $200 or $300 or whatever kind of plan you have. And you have your Part D premium, $20, $30, $40. On the right hand, Medicare Advantage plan is just the Part B premium of $148.50, and it includes all the same thing. The difference is you do have to stay in their network, and we'll go over that a little bit more in detail. So a lot of people just like that. I call it one-stop shopping. If your retirement plans, if you're planning traveling, some people like to go to different states and spend a couple months and travel a lot. You're probably better served by original Medicare and Medigap Part D plan, because Medicare Advantage plans don't travel well. They're more local. You have your local doctors and the networks. So the different kinds of Medicare Advantage plans are called HMOs, Health Maintenance Organization. These have a primary care physician or a gatekeeper. So he's the one, he and the insurance company have to give you authorization to go see someone. So if you say, I want to see, I think I need to see a cardiologist, you have to contact your primary care and have that discussion with him. He'll say, yeah, I think you should see a cardiologist too. We'll give you the authorization, and then you can go ahead and see the cardiologist, as long as that doctor is in the network for that particular plan, Cigna, Aetna, Humana, whatever plan you choose. So some people don't, I mean, the HMO is the most cost effective in terms of co-pays and for like MRIs or CTs and doctor's visits and stuff. But a lot of people don't like that, not being able to just call up and make an appointment. So they might be happier with a PPO, preferred provider organization. You still have to stay in the network for the most cost effective. I mean, you can go out of the network, but you'll pay out of network prices. And I happened into that situation one time and I said, how bad could it be? And trust me, it's really bad. So always try to stay in your network organization. So that's another thing. If you're thinking about Medicare Advantage plans, make a list of your doctors call them up and say, what Medicare Advantage plans do you participate with? Do you have a contract with? And so out of all those doctors, if there's only two Medicare Advantage plans they all have in common, that narrows your choice down. But there's nothing worse than joining a Medicare Advantage and save a little money and then find out that your doctor of 20 years that you are going to pay more because he's not in the network. So PPO, you can call up the cardiologist, make your own appointment. You still have co-pays, but you don't have that going through the primary care. Private fee-for-service plans, this is a specific contract between the company and the doctor. We don't have very many of those in Hillsborough County or in the area for that matter. In fact, I don't even see them come up on the list when we're looking for plan finders. So they're just not common around here. And then special needs plans. These special needs plans are HMOs with a primary care, but they're for specific disease entities like diabetes, pulmonary problems, cardiovascular problems. So they have benefits, enhanced benefits for that particular disease entity. So the SNP plans we call them, but special needs plans just have a few more added benefits and maybe no copay for some things that has to do with that particular disease. So if you find they're in a Medicare Advantage plan, have that discussion with your doctor and see if you might be eligible for a special needs plan. It just has a few more added benefits for that particular disease. So again, to repeat myself, if you're going to be in a Medicare Advantage plan, you have to stay with the network of doctors. So like I said, make sure that the doctors that you want to stay with are in your network. Some people don't care. They just say, I want a Medicare Advantage plan, sign me up, and they're happy with the doctors they have. There is the monthly premium of $148.50. Some plans charge less. You might get some money back. You'll see advertisements on TV where you get money back. And that's true. You do get money back, but then it's kind of, down the line, you may find you're paying a little bit more for an MRI or your copay is a little higher for this or something like that. But there's nothing wrong with that. You have your primary care. And if you find one that you're happy with and they don't charge $148.50, then you'll get some money back. Other costs, again, of course, are your monthly premiums. You do have the deductible. Some plans have a deductible, but you are going to have a copay. So a lot of people like them. A lot of people do it. The nice thing about Medicare Advantage plans is they do have limited dental, vision, and hearing. You have to stay in their network of providers. But for people that have never had any kind of insurance and couldn't afford some of these, this is huge. So you can get your Medicare Advantage plan and you can go to the providers they have for dental, vision, and hearing, and they're increasing those every year. Medicare is letting Medicare Advantage have more and more things to offer to people. So some of them added transportation or in-home meals or after hospitalization and stuff. So Medicare is giving them a little more freedom to offer things to us. Questions and comments. So that's the other way that you can get your Medicare. It's like I say, it's one-stop shopping. So how do you get all this? How do you do all of this? Well, you can call us. Oh, look, there's our number, 1-800-963-5337. That SMP stands for Senior Medicare Patrol, and that has to do with fraud and abuse, which we also have specially trained volunteers within our volunteer organization that address these. And fraud and abuse, of course, is just, I think we have some more slides on it, but I want to make sure we talk about it. So if you think that you have been a victim of fraud and abuse, you call our Shine number, 1-800-963-5337, and we'll get you in touch with one of our stellar volunteers. We have a group that are really good. So this is what the Medicare.gov website looks like, Medicare.gov, and everything that I'm talking about today is right here on this website. You can ask questions. It's really simple. Just type in whatever your question is and it'll give you up the information. So it really is easy to use. Telephone, the old-fashioned way. I'm old school. I like to keep Medicare in the loop. But chances are, if you call Medicare and say, I'm changing my plans, they'll say you didn't need to call us. So, that's up to you. But like I say, there's a lot of changes that happen on January 1st, or, things kind of sometimes get screwed up here and there. But I still like to keep Medicare, but that can be your choice. And of course, you're going to call the plan if you can go to these lunches and whatever they have and find out more about it. I would suggest narrowing the choices down to 2 or 3, because more than that, you get too much information and your brain might explode, and that's not a good thing. So pick a couple and then do whatever you have to do to find out as much information as you want. Make a list of questions. What's important to you? Ambulance coverage, uh, home health care, physical therapy, and then find out which plan offers the best in those things that you're interested in, and just narrow the search down, but it will be an informed decision. So the financial assistance programs, this is on the bottom of the one paper that we hand out. There's 2 financial assistance programs that Shine counselors can screen people for. There's extra help with prescription drugs or low income subsidy. This is processed by Social Security. So there's different levels of income and assets that people can have. So the benefits are based on your income and assets. And people with the lowest income and assets pay no premiums and have really small copays. And then the next level, you pay a little bit more premium, and you might have a little lower deductible, but all levels of the extra help with prescription drug costs do save people some money. And with LIS, you have the right to change your plan once every quarter, whereas most people who pick their plan in the open enrollment period can't change it again until the next fall. So if you feel like we have a handout for financial assistance benefits that has the levels of income and assets for both prescription drug coverage and the second one, the Medicare Savings Program, um, which has to do with Part A and Part B premiums. This one goes through the Department of Children's and Family Affairs. Now, we don't do anything other than just plug in the information and help you send off the application. The final decision rests with Social Security or DCF. But if you qualify for this, it pays your Part A and Part B premiums and your deductibles. And the highest income of assistance pays your coinsurance also. So again, if if you know someone, or maybe your neighbors, really having trouble keeping up with things, you could print out the financial one and kind of give it a look and say, well, look, call Shine and find out if you're eligible for any financial assistance. We get a lot of calls like that. So this is something to be aware of, and people don't know it's out there, and then they'll say, why didn't I know about this sooner? So it could be really a huge benefit for people. This is what it looks like, financial assistance for Medicare. So you can see on the one side is the Medicare Savings Program, which has to do with A and B premiums. And on the other side is the extra help with prescription drugs. You can see the different levels of assistance. So like I say, if you just get this paper, call us on the number, and we're happy to help you. We actually have people that can help you fill out the applications. See, I knew we'd get to Medicare fraud and abuse. So this is really, in the news all the time now, especially with COVID. Abuse is a payment for mistakes by providers. I want to say give the provider a chance to correct the mistake, keyword being mistake, because we do make mistakes. And to return the money to Medicare, it's kind of you got to write a letter, write a check, and explain to everybody and stuff. So give them a chance to correct the mistake. However, if you have a provider that has made this mistake and consistently makes the mistake, then you might want to think about abuse. Give us a call, and our people are going to look into it. Fraud is purposely billing for services that were never given. So if you look on your Medicare explanation of benefits and you see that maybe there was like you got a shot or something like that, and so, oh, that doctor never gave me a shot, question it. Question it. Call the office, and they say, oh, no, we gave you a shot. If you have any kind of a suspicion, call the Shine number and say, I just don't think this is right. And we have people that will get on it. And of course, the difference is intent, because some people do make mistakes. Prevention, it's all up to us to do work on this prevention, because Medicare loses billions of dollars every year because everybody's out to get your money, and not in a good way. So just guard your card. We don't have our Social Security numbers on our card anymore, but guard your card still the same way like your social, because one bad person gets a hold of your Medicare number, they can get a lot of money out of Medicare, not for good purposes. So just, make sure you guard that like you do your Social Security number. Um, I treat it like a credit card. Don't rely on advice from unknown persons. Like if somebody calls up and said, "Hi, I'm with Shine. If you give me your Medicare number, I'll be happy." No, the only time we contact you is if you've initiated the contact and you've called our number and said, "I need to speak to somebody," and then we're going to call and identify ourselves. But anybody who calls and says, "I can help you," pay for your COVID shot or give you this and that and the other thing, don't do it. It's kind of common sense, but they're really good at it and they, kind of real smooth. I've fallen for one myself, so I know what happens. So there's two things you'll get your, claim information about. If you've got Medicare, you're going to get a Medicare summary notice. You get that once every 3 months, or if you're with Medicare Advantage, you'll get an explanation of benefits. So it's always a good idea to look that over. See, Medicare paid for this office visit this date. You look at your calendar, see, yep, I was there. It just kind of, maybe, get the two, look at it, make sure that Medicare didn't pay somebody for something, that's not on your calendar. I had one gentleman call and say, "Well, I don't know who these people are that they paid." So I called and it was the billing office for his physical therapy. So when I called and told him that, then he was happy and he knew what that was for. So that's just, just things that we do. We're happy to do things like that. And if you see anything unusual, if you see something, say something. That's good for life, I guess. And please give us a call if you think that we don't mind following up on things that aren't. We'd rather do that than have something get way out of control. I'm good with like 2 minutes for questions. I don't think I have another slide. Our 5 counties here are Hillsborough, Polk, Manatee, and Highlands and Hardy County. And here's Amanda.
Okay, so I'm going to remind people that there is still time to submit questions. These can be about tonight's information. It can be about Shine, or it can be about maybe what you may have missed in Part A. And if we can't answer it in the short run tonight, we can go ahead and refer you where you can find that information. So we do not have very many questions right now, but we do have a question about, we just finished the program talking about some of the scams that might be out there for COVID. Are there any common scams you know of right now that are going around, Rebecca, that people might, certain wording? Because a lot of times, sometimes when there is a scam, it kind of goes around and you see the email or the call with the same information. Is there anything specific that you know of people should be on the lookout for?
I think we've covered it, well enough to where, like, because they've got it in the paper and we're trying to get the coverage out there, but that nobody's going to call and say they can get you a good deal on getting tested for COVID antibodies or anything like that. COVID shots are free, so nobody should have to pay for anything. So
Exactly.
if somebody says, "Hey, I can get you a deal on COVID shots," just get their number and call us. But it's just comes down to common sense. People should not have to pay for anything that has to do with COVID.
Right. And as you mentioned before, the communication is never going to be over the phone. It's always going to be, in the mail or from the administration
Right.
itself.
CMS, Social Security, Shine, we never initiate the call. It's always been initiated by you. So they're responding in response to your call. So
Okay. Well, I'm going to still give people just a minute more to submit any questions if they have. While we're doing that, I'm going to go ahead and share our closing screen here. Oops, I'm going to go back to that and just pull up my PowerPoint very quickly just to show people. Okay, so we'll go ahead and just remind people where you can get information. So as I'm doing this, I want to remind you one of the first places you can get information is go to the Handouts section on your control panel, or there should be an attendees section on if you're on a tablet or phone. Go ahead and click that because you can find the 4 handouts that Shine has generously shared with us. That has a lot of great information, not just how to contact them, but about their services, what kind of things you can find with Shine. So please go ahead. Those, if you are watching live, you can only access during the live portion. So if you do want to grab those, please feel free and go ahead and download them before we end the program this evening. You do want to get those. So that's the first place I'm going to recommend you find information. If you do have any questions for us, you can always give us a call at the library at 813-273-3652, or you can contact us online at hcplc.org/contact. That can be anything. That can be finding programs, what's coming up on our event calendar, how to get a library card, how to get your library card working again. We are there to help you. We are happy to do it. While we are sharing phone numbers, Rebecca, can you repeat that phone number for Shine for us?
It's a 1-800-963-5337, 1-800-96-ELDER. If you have a Medicare and You handbook, it's on the back of the Medicare and You handbook. So, or just Google Shine and it's going to give you a number to call. So it's pretty easy to find.
So that is their number. And then if you do want to know what's coming up in the library programming, you can find our full calendar of events at hcplc.org/events. Well, it looks like that is, we do not have any questions streaming in for tonight. If you do think of any, we've shared the contact information, so you do know where to find us. I want to say a big thank you to Rebecca McDonald on behalf of Shine for joining us again this month.
Thanks for having us.
It is great information. Okay, well, thank you to everybody who attended this evening, and we hope to see you at a program soon.
Bye.
Bye.
Good night.